Hey, Zarina. How are you?
Good. How are you?
I'm good. So we're here today with the ENT Institute. I'm the sleep disorder specialist, Patricia Lowry, and I'm with Zarina today. And we are going to cover CPAPs. What is OSA? How do you test for obstructive sleep apnea? And, just a popular question that people sometimes ask is, how did you decide you wanted to be a respiratory therapist?
Well, a respiratory therapist. I initially wanted to be a nurse. Went through nursing school for a few months, decided it wasn't for me. Then one of the counselors at the school told me about respiratory therapist and maybe becoming one. I went, shadowed a fellow therapist. At that time, I wasn't a therapist, and decided that, maybe give this a shot. And then also finding out that helping people breathe better nothing could be more rewarding than that.
So what about your past careers? What are some of the things that you've been able to do as a respiratory therapist?
Well, prior to coming to ENT, I worked at Children's Healthcare of Atlanta. About 16 years for that. I worked over there. So help patients, especially babies, kids of all ages with any sort of respiratory issues, trachs, sickle cell, cystic fibrosis, you name it, and also just cancer, lung cancer, things like that. Yeah, those are sorting.
I know that you and I are sort of on the same page with loving respiratory therapy. I love that I am a respiratory therapist. No better career, I think, than being a respiratory therapist. I think respiratory sort of chose me. I actually went to college to be a neurodiagnostic technologist, and so I got my degree in that, but I was able to get hired on with a hospital and as an instructor for neurodiagnostics, EEGs, EMGs, evoked potentials for the hearing. And so I was able to work in a department that had cardiology, neurology, and respiratory. And so doing that, there was just always a need for respiratory therapy. So I had a boss and he said, well, why don't you just do, respiratory therapy as well? So I said, okay. So, there was a school that was opening up near my home. And so it was a first-year school. So I was able to get in, and the rest is history.
I didn't even know that about you.
Yeah.
So Patricia, we've been getting a lot of questions on our social media regarding obstructive sleep apnea. Can you let us know what that is?
Sleep apnea is a common sleep disorder that causes frequent pauses in breathing during sleep. Most people with sleep apnea experience symptoms such as loud snoring and daytime sleepiness. The two main types of sleep apnea are obstructive sleep apnea and central sleep apnea. In obstructive sleep apnea, a narrowing of the airway during sleep leads to breathing disruptions. In central sleep apnea, the breathing disruption is caused by the lack of communication between the brain and the muscles involved in breathing. These breathing interruptions reduce the quality of sleep and, if left untreated, can lead to potentially serious health consequences. It's critical to work with the physician if you think you may be at risk for sleep apnea so that you can get any testing necessary to treat obstructive sleep apnea. Zarina, now that we know signs and symptoms of sleep apnea, what are some of the risks associated with sleep apnea?
That's a great question, Patricia. So as we age, your chances of sleep apnea will increase as well, up till you're in your 60s and 70s. Also, if you have a higher BMI, body mass index, your chances will increase of having sleep apnea. It's also hereditary, so if you have parents that have it, you might have it as well. If you have a large head and neck circumference, that can increase your chances as well of having sleep apnea.
Right, and I know one of the biggest things is your weight.
Yes.
So, when you have a patient who comes in and that patient is obese, there are certain numbers that, together with an Epworth sleepiness scale, the physician looks at those numbers along with the Epworth sleepiness scale, and he then decides testing or, to further the exam with testing, whole sleep testing, or an in-lab sleep study.
So, Patricia, can you tell us how a sleep study is diagnosed?
Absolutely, Zarina. Great question. Sleep apnea must be diagnosed by a doctor or a sleep specialist, and there are several steps in the diagnostic process. An evaluation for sleep apnea must typically start with a review of a person's symptoms and overall health, as well as a physical exam. This is designed to detect certain signs and risk factors that can contribute to the condition. Although testing is required to confirm that someone has OSA, the presence of symptoms can factor into the diagnosis and help determine the severity of the condition. So this is one of our CPAP APAP units that we use. It is the ResMed AirSense 11. This ResMed AirSense 11 has the capability of being an APAP unit or a CPAP unit. It has both modes. The CPAP is the continuous positive airway pressure mode, which gives you one pressure. The APAP has the titrating pressures. You set the parameters of a minimal pressure and a maximal pressure and allow the unit to titrate to your perfect pressure needs every night. So this is one of the ResMed masks. It's a full face mask. It's an F20. These masks are great for CPAP users who have the urge to go to the bathroom several times at night. You have the tubing that comes here, but this has the flexibility of being able to unclip without taking the headgear and the mask off. So you can go to the bathroom, and when you come back, you can just clip it right back in, and then it hooks onto the patient's mask. So it comes off and it hooks right in. So this is the ResMed P10 nasal mask. This nasal mask is a very sleek, if you have a patient.
It was actually my favorite mask.
Yeah. So these right here, if you have a patient who is claustrophobic or, they don't want a whole lot of the garb on their face, we recommend these nasal pillow masks. These nasal pillows, they go right in the nostril, and as the air comes in, it actually blows up these nasal pillows and it creates a seal. The Watermark Medical Aries 620 is an at-home apnea test that measures 9 breathing and sleep health metrics. It's designed as an alternative to a lab-based sleep study to determine if a patient has OSA. The Aries 620 is cleared by the FDA as an at-home OSA test. The device consists of a headband with a forehead sensor plus a nasal cannula with prongs that are inserted into the nostrils. Together, the sensors track 9 primary metrics that can help your healthcare team determine if you have OSA.
So, Patricia, it's been great talking sleep with you. Very informative. Hopefully we can do this again soon.
Absolutely, Zarina. One thing that we would love for every podcast listener to understand is that we are here. If you have signs or symptoms or have any risk factors within your family for obstructive sleep apnea, please don't hesitate to give us a call. Come see the experts at the ENT Institute and let our family take care of yours.